Welcome to BriefBites for Better Care. Today I'm going to look at errors. We all make errors. I know I do. Last week I put sugar in my wife's coffee instead of my own. A minor disaster for us both. If we make errors in the fairly simple tasks of daily living, it's not surprising that we make them in healthcare, which is far more complex. There are two broad types of errors, slips and mistakes. In slips, what we do is not what we intend to do. We intend to boil water, but we forget to put water in the kettle. We write up a drug, but we accidentally put the decimal spot in the wrong place. Slips are more likely in skilled people than in novices. Why is that? Because skilled people do many tasks automatically. We use intuitive thinking, and this increases the likelihood of a slip. Novices pay attention to each step of the task. They use cognitive thinking, it's slower, but slips are less likely. In contrast to slips, mistakes happen when we form the wrong plan or have the wrong goal. We might do the action correctly without any slips, but if the goal is wrong, it results in a mistake. We might make the correct diagnosis, but give the wrong treatment, perhaps because we don't know what the right treatment is. That's a knowledge-based mistake. Or because we follow a rule about a drug dose, but we don't factor in that this particular patient has only 50% kidney function, and that this particular drug is excreted through the kidney. That's a rule-based mistake, following the rule without thinking carefully through it. So what can we do to reduce errors? Here are 5 things we can do. 1, know that when we do things automatically, the chance of a slip is greater. 2, use checklists rather than just relying on our memory all the time. 3, standardise equipment and procedures. 4, work in teams. And 5, and this is probably the most important of all, make the patient part of the team. Tell them it's okay to ask us questions. See you again on BriefBites for Better Care.